This is Virginia Kaufman. She's a physician assistant senior student from Daemen College. She's going to be talking about restless leg syndrome. Go ahead, Virginia.
I'm doing a presentation on restless leg syndrome for an audience of physician assistant students at Daemen College. This is a diagnosis that is often missed by clinicians, and the diagnostic criteria is important in order to properly assess these patients. The criteria is the following. Criteria number 1 includes an urge to move the legs, usually accompanied or caused by unpleasant or uncomfortable, sometimes indescribable sensations in the legs. Sometimes the urge to move is present without these uncomfortable sensations, and in some patients the arms or other body parts are involved in addition to the legs. The second criterion includes the urge to move or unpleasant sensations begin or worsen during periods of rest or inactivity, such as lying down or sitting down. The third criteria shows that the urge to move or unpleasant sensations are partially or totally relieved by movements such as walking or stretching, at least as long as the activity continues. The final criteria, which is the fourth, states that the urge to move or unpleasant sensations are worse in the evening or at night than during the day, or occur exclusively in the evening or at night. In case of long-standing and severe restless leg, the worsening of symptoms at night may be noticeable but must have been present previously in the past. The 4 diagnostic criteria must be met in order to diagnose a patient with restless leg syndrome.
Thank you, Virginia. This presentation with the diagnostic criteria is helpful because it's an underappreciated disease, restless leg syndrome, and I think if people consider this in their differential diagnosis and use the criteria to make this diagnosis, it would help a lot of people because this is a very debilitating condition. It's often progressive as time goes on, and as she emphasized and stated earlier, in the beginning it may just involve the legs, but as time goes on people can also have problems with restlessness of the upper extremities. So it's just not restless leg syndrome, but restlessness of the extremities. Thank you very much. This is Dr. Carol Manoukian from the Vein Treatment Center and veins.com, and this is Virginia Kaufman from Daemen College, who made this presentation for the diagnostic criteria of restless leg syndrome.